So distraction osteogenesis is a technique for growing bone. And it's the principle that if we can surgically create a growth plate and then allow the bone to form in a reparative way within that bone cut, and then pull the ends apart and make that gap bigger, at a physiologic rate, the body will grow more bone in the gap. So we create a growth plate where we can lengthen the jaw, bring the face forward, make the legs longer, correct the length of the forearms. So there are different techniques that can be used with distraction osteogenesis using that principle in pretty much any bone. So distraction osteogenesis is used to treat patients who have major craniofacial deformities, such as Treacher-Collins syndrome, hemifacial microsomia, Goldenhar syndrome, and some of the other deformities where the jaw or face hasn't grown completely. We use it sometimes in cleft lip and palate patients also to bring the mid-face forward, and sometimes in patients who have other deformities of the skull, we can adjust the eye sockets and other bones like that using distraction osteogenesis. In the orthopedic realm, distraction osteogenesis can be used to lengthen legs, make people taller, and also to correct post-traumatic deformities where one leg is shorter than the other. Well, usually patients who have a major craniofacial deformity, it's diagnosed pretty early in their life. So they know it soon after they're born. The youngest patient I've operated on has been 6 days old, who had Pierre-Robin syndrome. And so in those cases, the jaw is small. It affects the airway. So many times it's not a cosmetic issue or even a bite issue or a facial proportion issue. It's a life-saving issue to bring the jaw forward, to grow it, to open the airway. Well, I have patients from different parts of the country to treat them regarding distraction osteogenesis for their deformity. So sometimes they'll find me on the website, sometimes they're referred by other doctors, sometimes the hospitals will call. It's a wonderful operation because it saves the large bone grafting, it saves taking the rib grafts from the chest on these little kids. So it's a very important development that's come along over the years. I've been fortunate to be involved in that development with some of the devices that I've invented, and so it's become a wonderful thing to treat these kids.